or contact Phoenix Management International at 210-944-4926, email outreach@phoenixmi.org, or visit phoenixmi.org. The Wright Health System's Marquee Community Health Fair, Sunday, March 8th, 12 to 4. We will see you there.
All right, everybody, that is a good segue on what we're getting ready to do. We got Dr. Gloria Wright here with us, and we had her on earlier, and she's back again because she only hit the tip of the iceberg on things that she do in the community. And when I went to go meet with her, and she sat down and talked to me, I was just blown away. All the stuff this young lady is doing, not just in San Antonio, but throughout the United States. And she has a story, and I'm telling you that we could sit down for hours and talk to Dr. Wright. But anyway, good morning, young lady.
Good morning, everyone. Good morning, Ron. Thank you so much for getting me back here. I guess I can't get enough.
You look like you are ready to set up your background. You're not over in the gardens, are you?
Hey, that is my make-believe in my zone of vacation, relaxation, and I put my mind where it needs to be.
Oh wow, and that's what I'm talking about. You know, I was after I visit with you, it was I was sitting back and thinking of things that you do, and we sort of had one thing in common is we took something and started by ourselves. And we're building it into something. And what I like about you is not about you. It's about the community and things you could bring to people. And people don't understand that because you are very humble in the things that you do and success that you have. And to me, that's the making of a good leader. That's the making of somebody who really cares, who has the empathy that we lack nowadays. And you have that. And you're just, I'm going to say it again, you are just so humble. You tell me all things you do. And I say, are you kidding me? You do this, this, and this. I was just blown away on the things you could do.
And yes, I want to say thank God. Privilege is given. Spider-Man, I think that's where they first said it. To whom much is given, much is expected. But, it is an opportunity. You shared a little bit about your background, and I talked a little bit about my background as well. And I think when you come from a place where you have gotten to experience some of the things that we went through, you don't take anything for granted, and you look always for how can I benefit others around me. And you're always looking for who can I reach out to next? Who can I
Hmm.
pull up with me next? So
Yes.
I think that's been where my motivation and drive is coming from.
Okay, so let me ask you something. What is Phoenix Management International, and what service do you provide to the public?
So Phoenix Management International was birthed from the need of us to be able to help the community, especially women in businesses. I came from a spot about, um, I would say, from my childhood, a business perspective. I have always been in business. As a little girl, being an entrepreneur. And I realize as you get older and grow into business, you get to find out there are several things that you have to understand. And when it comes to managing businesses, it takes more than just the fact that you are a business person. It goes beyond that. I'll give you a good example. I was talking to someone the other day and they were talking about, oh, how do I go about this? How do I go about that? And I listened, which is one of the good things about Phoenix Management. We listen and we say, where are you? What are you needing? How can we come in? And a lot of what this person talked about was more into they are needing motivation to get started. They are needing to, and I said, I'm sorry, that's not Phoenix Management. And that's what you want. You want to know, does this person have a niche? Do they understand
Mm.
what they are able to offer you? And I was able to tell them, I'm not the right person. I'm not the one to give you the you can do it motivation to get started. I'm the person who comes on when you have already gotten started and you're saying, okay, I don't want to be a slave to my business. I want to grow my business. I want to scale it. That's where we come in together to work with that person. So, yes, Phoenix Management, when you talk about business, we are big in helping those around us on a larger scale.
Wow. That's I like that. So we're gonna go into this right now. What is Right Health System and what is your role with it?
So, Phoenix Management, first of all, manages several entities and we have subsidiaries. So, Phoenix Management does consulting, management, brokerage, and also advisory. Right Health Systems is one of the organizations that we manage. Right Health Systems, I'm fortunate to be the founder. It is a nonprofit organization and it was birthed out of the need that we saw in the community for social services. And when you talk about healthcare, it is impossible to tear away social service from healthcare. I've emphasized, especially for us at the Right Health Systems, our primary focus, yes, is with mental health. That's our primary focus. We want to service people. We want to be able to cater to them for every and any mental health concern, from patients age 9 all the way above. However, it is impossible to tear away the social need of that patient. It is impossible to say you don't recognize their housing needs, their financial struggles, the maybe food and nutrition that they may be having concerns with, employment. So, in order to be able to service them fully in a holistic sense, we have to be able to get them support in other areas, even sometimes to say for those who don't want to go the prescriptive route, they want to go the herbs or supplements or even a specialist care. The Right Health Systems focuses one on mental health, but also brings the element of the social work to the forefront. And that's the big part that we play in our patients' life at the Right Health Systems.
Wow. So do you think community talk about that? Why is community health work so important right now in San Antonio?
I know everyone, even those under the rocks right now, they are very familiar with what's going on with the healthcare structure. It is a big issue that those who have insurance, unfortunately, have lost it because they don't have their jobs anymore. And those who have their jobs and are able to keep the insurance, some of them, unfortunately, have now gotten to the stage where their premium has escalated. And so you that maybe have $100 deductible, or say, copay or whatever, now you are having to pay up to 1,000. That is a huge jump for anybody, right? And so when you are talking about what the social work has to do for any of this is insurance would tell you, no, we don't cover this. And if even if they do, they would say, let the patient come and we'll take care of them. And by the time the patient is, I mean, imagine someone who's having a stroke or asthma attack, and you're telling them, well, you have to wait before you get the help. Why do we do that for mental health? Why? Mental health, when we talk about social services, that is one of the bread and butter of what we render and what we want people to be able to get help with. So when it comes to right health systems, that's one of our big focus. And when you talk about social services, you cannot tear it away from the fact that it is essential when you talk about mental health and even healthcare in general in our community.
You know, you said a mouthful right there on the premium and everything. I'm a victim of that because I went to go get my medication and it jumped 3 times, and so which I will blame myself in a way because I didn't look at the paperwork when my insurance. Well, they do it every year, and I failed to see things in there. Oh, I called them up right away and we switched everything over, and that was my fault, assuming that I'll have the same coverage as last year. But no, they didn't do that. And normally they let you know. I didn't get an so basically I turned around and redid my insurance, so now everything's okay. See, but I have the opportunity, I could do that. But it's people out there that get penalized. This is what I don't get. Why you get penalized for not having insurance? You gotta pay. You gotta pay for not having insurance. You know, if I could afford insurance, I have it. Now that I get it, you gonna deduct stuff from my Social Security and all that stuff because I didn't do it right the first time around. And you talking about mental health, but all this stuff going on, people are at edge right now. And you know what the government is doing, and what they're doing is, this is just my opinion, Dr. Wright. They are looking at the middle class and the lower class. And this has always been citizens who have been paying to have the government run, using our money, the entrepreneurs and all that stuff. But then they dictate to you and tell you can't have this, they can't have that, but they got it. And mental health go along with that because people are getting fed up. They're getting tired. They don't know what to do. We don't want people to snap.
And no, we don't. No, we don't. And that is where if you look at the pillars of right health systems, it is number one to advocate for our patients. We look for every way to speak up for them, on behalf of them. We went to the insurance companies and we spoke to them. And yes, the resolution was not very favorable. It wasn't that there wasn't a resolution, but it wasn't very favorable, in our opinion, for the patient. However, we figured, what is the next step that we can use to help this patient? Collaboration, right? So we, especially with the Right Health Systems Health Fair coming up on Sunday, March the 8th, at the Botanical Gardens from 12 to 4 p.m., that is the reason why we want to have that. We are looking to show the public collaboration is key. You can't on your own, no matter how good you are of a provider or specialist or primary care, whatever you do, you cannot on your own be sufficient for all the patients need. So we're bringing together all of the resources and professionals that we feel we can accommodate for that one event, which the good news is we are right now in talks with several cities around San Antonio. And the goal is to take this same model that we have with the directory that we're putting together to each of the cities so that way we can establish similar situations with them. And when we advocate for the patient and we collaborate with the other professionals and resources, then we now educate them. You are fortunate to be able to call and understand what to say. What happens to the grandma who doesn't even know she could call to say, hey, this is what's going on with my prescription. I need it changed. What's going to happen to the young man who finally got on insurance, has never been on it before, and does not understand how to navigate the process? Those are the things that we bring on to the community. We advocate, we collaborate, and then we educate. And so that way, we are not just telling you, hey, we've spoken to your insurance on your behalf, now you're on your own. No. Or, hey, we've connected you to that resource, now you are on your own. No. We then bring it to even the forefront of, now, this is the day-to-day, step-by-step that you can do to help yourself through these situations. So that's what the Right Health System is about. And I really tell everyone, if you know that your goal for any patient or anyone in the community, be it an organization, be it a city member, we say, come to us, help us. So that way we can really help the community beyond the basics of mental health, public health, specialty care, or primary care.
I like that last part you said, educate, because a lot of them they know the basics, but they don't know the ins and outs. With somebody out there to educate them, this is what you need to do. I think that is a step forward, which brings me to this question right here. I just said, if someone does not have insurance or primary doctor, How will this event you have coming up help them?
So the good news is you don't have to have anything, right? Um, One of our primary sponsor, United Healthcare System, they will be available to help with those who might be needing connection, but we don't limit it to that. If you don't have a primary care doctor, you don't have a specialist, come on over. You will get to speak to those in the community who can connect to you. Don't forget, our primary focus at Right Health System is to advocate and collaborate. Hey, I need a nephrologist. Hey, I need a GI specialist. Hey, and whatever you're needing, we try to connect you to those resources. That's one of the things we do. Moreover, we talked about our directory that we're putting together. Our goal is to access. Now, you will find a lot in the community. There is, say, San Antonio resource. There is, whatever city resource, but you don't have all the cities put together. At least San Antonio and the neighboring cities put together. You might find nonprofit only resource, for profit only resource, but do you have all of them in one? You might find one specialty only resource, say, for example, primary care resource or pediatrics care resource. Do you have all of them in one spot? What we are putting together is to have as many cities as possible in the area, as many specialties as possible, and as many, be it for profit, no, for a nonprofit, whatever, bring them all together. So that way, and it will be open, free access to the public. So if you're curious, how do I go? Who do I talk to? Here you go. You're literally handed a platter of information for every and any city around the San Antonio area and any and every specialty around the San Antonio. Because I say this, and then some people look at me and say, if you don't take care of your neighbor, one day whatever is smelling in their house is gonna sip into your house, right? And so
Yes.
if San Antonio is like, yes, we are here, we are big, we are good, Kirby, Selma, Universal City, all of those, they are our neighbors. Whatever is going on over there, if we are not looking to collaborate together, it's going to spill into our city. And we have
Yes.
to be able to help with it.
Okay, so after the event, what is the next step? How do people stay connected and get follow up support?
So the first step is hopefully the directory, right? We're working to put a site together where people can go and be able to access all this information. We're still gathering information from the neighboring cities. We were fortunate to work with the Tri-County area. They have theirs. Mayor Grider of Kirby is already part of us and helping us with these resources as well. Already San Antonio, Bay County Clerk Office, Honorable Lucy Adame Clark has also been very helpful with this. We have all these people who are seeing what we're bringing, and they are like, yes, we agree. We know this is needed, and we're going to support. And so, aside from all of those resources, we are also looking to see if we can get, say, for example, financial support, because we know it's never just going to be by itself running without proper funding. We're
Right.
saying to organizations, if you are able to support us, please do. If you have talent that you are able to support us with, or you have time that you're able to spare with, let us know. Time, talent, treasure, whatever you have to spare, we're looking to get all the necessary support. Now for the people, we would say, keep on, first of all, be there Sunday, March the 8th. It's at the Botanical Gardens. I mean, the Botanical Gardens will be having several exhibitions going on around that time. Come enjoy the garden. Come enjoy the trails. You can walk around. You can enjoy all that is around there at that time. And most importantly, you can get all this information. And even if you have questions, you can get the chance to ask some of the city members that we will be bringing on that day. You can ask them those questions. Hey, this is what I'm going through. How do I navigate it? What do I do about it? And you might get a straightforward answer that day. So come on out, first of all. Sunday, March the 8th at the Botanical Gardens. from 12 p.m. to 4 p.m. We're going to be having the right health systems there. And then we can start doing all of the other connections that we can provide. And you can still check out our website if you need more information.
Yes, it's a nice website and everything. You know, I really do. I explained to you. I wish I could make it out there, but I'm stuck somewhere else. But I'm a support you and do things for you. Whatever you got coming up, I'm there for you. You name it, and I'll check my calendar and make sure I'm in there and do things for you. Because I think this is a good, worthy cause, and the word needs to get out and let everybody know. Like one of my slogan on my nonprofit is called Ask the Lonely. And in that tag I have in there, you are not alone. And people got to remember when it comes down to mental health and all that, you are not alone. There's resources out there for you. And I applaud you for having resources out there, because some of the biggest things I get from people is, I don't know where to go. I don't know what to do. I get phone calls all the time and I steer them in the right direction. And I had to tell myself, oh, I'm a resource too, because people are calling asking me. And if I don't have the answer, I'll call around and get the answer and then let them know, or steer them to
The right place.
call this organization, call this, call that. Girl, I'm going to be bugging you because I'm going to steer a lot of people.
And I'm open. Send them over. Send them over.
Because it's amazing how people have needs and wants, but it's only one thing, Dr. Wright. People are scared to ask some of them questions. They want to self-medicate or self-evaluate themselves, saying, I could do it. Because being in the Black community, we are brought up to be strong. Don't seek help for anybody. Whatever happens in this house, stay in this house. And as you say, sometimes it runs over.
Yes.
So we as a people, we got to understand there's resources out there for us, but we have to get off our butt and get out there and talk to people.
Yes. So there's a little saying that we have in my Western African country, Nigeria, where they say it's only a child that spreads out the arms to be lifted that typically is lifted. Now, yes, on a few occasions you might get carried if you are not even asking for it, but typically a child who comes up and says, "Hey, carry me," those are the kids that get picked up. So if you are in a situation where you are needing help, yes, for some people, ego may be the thing, pride may be the thing.
That.
And for some people, shame may be the thing. Oh, they're going to call me weak. They're going to say I'm not strong enough to handle this. Or they're going to say I'm a sissy. They're going to say I'm a whiner. Just ask. West Care, Texas, Dr. Keely Petty, I don't know if you've ever worked with them. She actually has an event, a training that she does for church members. And she would actually train pastors, because you'd be surprised when people come to the pastors, oh, let's pray. Yes, pastor, you got to pray. But you also have to understand what else is going on with this person, right? Don't just pray and say, thank you, bye. How else can I help you? Who can I refer you to? What type of help do you need? So those are things that we say, don't just keep it to yourself, right?
Right.
And for every one of us, we always scream, mental health awareness, mental health awareness. I still say to anyone, wherever I enjoy getting out there, if you're talking about mental health promotion, mental health awareness, I am a big advocate for that. Call me up anytime. You want to talk about it, you want to educate, call me up anytime. And for that, we have to keep promoting it in the community. We have to keep telling people, don't stay quiet, don't feel like you are alone, talk to somebody. And you don't know, just like you say, you're a resource hub, you don't know who you talk to, who is able to say, okay, let's get you this. And like we said, sometimes it's not that the person is depressed. Heck, they don't have a job. They just need an employment. And so someone may be able to help me with that.
And sometimes they may just need to talk. And a lot of people don't realize. Now, somebody told me this, and it's so true, that a woman will sit down and she will cry. And once she cries, she feels better. If she's got it out her system, she's fine. But a man will hold that inside and keep on holding it inside until they explode. and we don't want
Men
that to
don't cry.
happen.
Big boys don't cry.
Exactly. And so then it was another um, mental health person that I know. She sat up and told me, she said, "No, Ron, ever since the pandemic, this has gone up. And what's happening right now, we're seeing over 500 people for one mental health expert. 500. And we
I'll
need,
tell you. Sorry, go ahead. Go ahead.
and said we need more.
Yes.
We need more mental
Yes.
health people going into that field. And it just like nursing, we don't have the capacity to take care of all these people.
Yeah. And I wanted to say the city of Kerr, when the July 4th flooding happened, and unfortunately, the whole situation that happened there, they have been dealing with the aftermath. And when I say the aftermath, they are talking about even, getting people trauma, because there's a lot of trauma that happened during that time. People who lost their family member, people who lost their houses, people who had to start all over again, all of that factor, and they're having to deal with it. And so what I say is, yes, the need is there, and there is not enough people. I agree. There is not enough providers. There is not enough specialists to take care of all those patients. But is there an opportunity to collaborate? There is that collaboration
Yes.
opportunity. And if you just sit in that one city and you think, oh, okay, we got this, it's not about can you do it alone. It's about can you do it efficiently and in a faster time with the most benefit to the patients, right? And so I love engaging in community activities. I love engaging with other organizations. I would tell you here in San Antonio, I'm fortunate to be the president for the Alamo Area Psychiatric Nurses Association, which is primarily filled with our psychiatric nurse practitioners. And we had made an announcement, at least by my primary organization, Insight Mental Wellness, that hey, when the current situation happened, we can help, right? We can provide services. We even have our mental health access program, which is free. Not well. We have a sliding scale and pro bono. We assess the patients for qualifications and all of that, and we have that. And we say, hey, reach out. We still got nothing coming through. But recently, there were two different publications detailing the fact that there were several people who were still struggling with mental health issues in these impacted cities because they don't have enough providers. And I keep saying, somebody, who do we talk to? How do we connect? You know, Mental health doesn't wait for anybody. And unfortunately, when it becomes a crisis, then everybody starts screaming, oh,
Yeah.
there's a crisis, there's a crisis. But we can do something. Collaboration, collaboration, collaboration. We're hoping they listen.
Yeah. I want to go back and touch on something. Growing up, there was a saying that if something tragedy happened and kids are involved, their favorite word is, "Oh, they'll grow out of it." But that whatever happened, like the flood right now, this is going to be with them for life. You can't grow out of that. It's going to be with them for life. Matter of fact, once they grow up and they get out there and they have mental issues later on in life, they haven't really dealt with what happened to them back when they were a kid. So a lot of people bring what happened to them as a kid into the adult life, and they really never get over it. And people don't seem to understand that when
Yeah.
something tragic happened, it's with you for life.
Yeah. I'll give you a good example of such. And once again, mental health is the one biggest passion I would ever have. I had a patient who, as an adult, struggled with um, going into the kitchen, reaching into the cabinets at the top shelf to grab items. Imagine that simple task. Going into the kitchen, reaching up to the cabinets at the top shelf to grab items. She every time said, every time I'm about to do that activity, I get a mixture of emotion and it's so overwhelming and there's so much going on in me. And I'm like, what has that got to do with anything? You are only reaching to grab item in the kitchen. It's a and so after we've talked about it over and over, and I've tried medication too, and I was like, hold up, this is not a medication issue. Let's get you with counseling. Got her with counseling, took her a few sessions. Finally, she started unraveling. Like you said, they're going to grow out of it. No. Sometimes you push it down, you push it back, you don't want to look at it. It doesn't mean it's not there, right? And so this lady, apparently, when she was going to find out, was the fact that, you know, it was an incident that happened when she was much younger. And the situation surrounding that led to that trauma. And because she was not listened to, you know how it is. Oh, you'll be fine. It's all in your head. Oh, it's
Yeah.
okay. She suppressed that emotion. But unfortunately, here she is as an adult, dealing with a demon she didn't even understand until she finally started unraveling. It's like an onion, and then you have to start peeling out the back. So you have to start peeling
Mm-hmm.
till you get to the main part, and you say, "That's what it was." And until she dealt with it, she was suffering from that. Imagine such a simple task.
Yeah.
Imagine that.
Mm-hmm. And they do, and sometimes it'll take something that'll trigger people off that happened to them in their childhood. It triggers something, and I knew this one couple. They were together for years, and something happened that triggered this young man, and he just went into a different area. His wife didn't know what was wrong with him. Finally, once they seek help, they found out that something happened in his childhood. And so it was almost like dealing with that grief all over again.
Yes. And don't ever say it was in the past. You should have gotten over it.
Mm-hmm.
That is such a deadly statement. Or, oh, someone tells you something. Oh, yeah, that happened to me too. Listen, we all process things differently, right?
Mm-hmm.
There is something we call intrusive thoughts. And intrusive thoughts for some can be as simple as they walk into a setting and something there triggers. There are things we call flashbacks.
Mm-hmm.
I'm sitting down, I'm happy and I'm smiling, and all of a sudden, boom, that thing comes back again in my memory. Oh, wow, that happened like 50 years ago. Why are you still in your feelings right now about it?
Mm-hmm.
Everybody processes differently. Give that person time, give that person space to express whatever it is that they may be going through, however, it may have impacted them. They say the way you do things you may not remember, but the way it impacted me, I will possibly remember.
Mm-hmm.
Right? You said, "Oh shoot, I just tapped you. What do you mean?" No, but your tap meant something different for me.
Yeah.
So it's sad that, in certain communities, and I'm not gonna say, oh, it has to be just black or Hispanic, because it's this time it's across the board, everybody.
Yeah.
Let people process their trauma, right?
Mm-hmm.
Let them go through whatever they're going through. Let them deal with whatever they're dealing with. And whenever they finally say, yes, I am gone through this, I have, gotten to the point where I feel better about it, then help them still. Because why? Intrusive thought, flashbacks, and all of those are still gonna be there, and we want them to be able to process it. So
Wow, that is so true. You done hit some good points this morning, young lady. I appreciate you being so open and honest with everything, what's going on. So, what is one of your health message you want every listener to take away today?
I said it last time and I'll say it again. Especially for mental health. You are never alone. You are not. You can only be alone when sometimes you choose to be. Why? I share with especially my younger patients. I say, even as a mental health provider, I cannot read your mind. A
Mm.
psychic, even though sometimes can claim they read your mind, they still need some clues to read the mind. You will
Mm-hmm.
hear them say something like, Hey, I hear something. I hear a name. Does James sound familiar? And then you have to respond with, "Oh, that's my uncle's name. That's my grandpa's name." The same with mental health. You are not alone. But if you don't verbalize what's going on, it's gonna be hard. I really hope the community and the word in general can learn to say mental health, because we have certain sectors that demonize anytime you open up about mental health, and
Mm-hmm.
they make you look weak, and they make you look like you're lying, and they make you feel like it's all up in your head. I hope people will learn to stop that. Someone who scrapes their feet or their whatever, you would see everybody say, "Oh, are you all right? What happened? How can we help you?" But when I come and I say, "I'm having anxiety, I'm having," I say, I didn't know how bad panic attack was until I had it, because I was telling my patients, "Oh, yeah, we're going to do this, we're going to do that." But the day it happened to me, ooh.
Yeah.
So I want everyone to know, please, mental health is not just in the head. It can be helped, but you have to speak up. And if there's any organizations that seeking assistance with promoting awareness, I say, please let us know. We'll be more than happy to assist. And most importantly, join us, the Right Health Systems. It's the health fair on Sunday, March the 8th. Come learn more about us. Come collaborate with us to help the community. We would truly appreciate it.
Yeah, and I'm telling you, I looked at the flyer and all the things that you offer on there, and I'm telling you, it's a win-win situation. Whoever goes, I mean, it's right there for you. Whatever you want is sitting right there for you. You even got yoga classes and all that going on. So, we,
So what we have going on that day, we have the yoga activity, which we're still keeping the yoga activity, although Miss Bonnie, who was originally supposed to be on there, unfortunately has another activity that's taking her out of town, so she won't be available. But we're trying to get another yoga instructor available. We have the fitness, we have the, oh no, I take that back. Yoga is still intact. Zumba is the one we're having to switch out our instructor, but the yoga is still there. The fitness is still there. The trail walk with Dr. Ify is still there, and she is a big hiking fan. She's always going on different hikes, and the most recent one they had, it was with a very beautiful scenery. I was like, oh, I wish I had gone on that one. But that is there, and you get to walk the trails. You get to enjoy the botanical gardens. You get to go into the different areas. Enjoy. There's food. There's entertainment. There's fun activities. There's resources. You can bring family. You can bring friends. We encourage actually the whole family to come because it's free. Bring
yeah,
the kids. It's in March. It's on Sunday, right after service. Everybody, or if you're home for the day, get up, come on over. 12 o'clock, come right in. Enjoy the trails. Enjoy. It's free to everyone. So we say, come on over. We're looking forward to having everybody there.
you know, I like the gardens because I'm a photographer, and sometimes I go out there and I bring my camera. Some of the pictures that I take out there. I got one photo that I have a bee pollinating a flower. And I'm surprised I got that photo. So I like going out there walking. I go out there sometime twice a year just to get out there and see nature. And in a way, no, it's not in a way. You picked the perfect spot because that's nature out there. You out
Yes.
there, put that cell phone down, put
Hmm.
that iPad down, get
Hmm.
out there with Mother Nature, and
Yes.
just experience the fresh air, the fresh smell of
And
the
I was gonna
flowers.
say the fresh air, enjoy. Now I hope where even we have one of the on-site services, we're trying to get our allergists out there, because a
Hmm.
lot of people is like, oh, I can't go. I'm allergic to this. I'm allergic. Come on out. We're gonna do a free testing. You can get to figure out, oh my God, what am I really allergic to? What's really bothering me? And then you
Hmm.
get to find out, okay, I guess whenever it's getting to be it mountain sitter or whatever it is, I gotta, get myself all ready. And how can I, prepare before the time? So we have so much going on. It would
Yeah.
be a great thing for anyone who's looking to come out with us.
It is great to be out there. All right. Any closing words you want to tell the audience?
Sorry, I got muted. But yes, in closing, I would love to still say, please don't forget, if you are coming out Sunday, March the 8th, it is at the Botanical Gardens. It is free. I say to share with any and everyone you can. We have lots of resources, so you don't even have to worry about numbers. There is actually some food items will be giving out, fresh produce, so those who are in need can get some. There will be some clothing items that will be given out. So that way you don't come and you're like, okay, well, I talked to a doctor already, but I'm hungry. Yeah, you can get some fresh produce home and maybe make a meal. Or if you're needing, clothing items, there will be some. There'll be some items that we'll be having available. But we say coming out. It's
Yeah.
Sunday, March the 8th at the Botanical Gardens. Starts at 12 o'clock, noon, all the way through 4 p.m. We encourage you to come join us. There are lots of resources. And for organizations, please let us know. You can reach us at outreach at phoenixmi.org. That's Phoenix like the bird. Or you can reach us at info at righthealthsystems.com, which is right, RIGHT, healthsystems.com. And that systems is with an S, because we're trying to bring together all of these resources. We look forward to having everyone. And we say thank you so much, Ron, for having us here.
I appreciate you coming on. Like always, you are a wealth of knowledge and resources. And we appreciate you taking the time out with us this morning.
Thank you so much. Appreciate the privilege. And I hopefully look forward to seeing everyone there Sunday, March the 8th at the Botanical Gardens.
Okay. We thank you, and we'll talk to you later.
You too. You take care.
Okay, bye.
Record.
All right, everybody. That was Dr. Gloria Wright here on WSAN Radio. So we got some more coming your way. We got a guest coming on at 12 noon. Let me see who that guest is. What did I do? I just love being on live when I don't have anything lined up, but that's all right. We're doing our thing right here. We're getting it together. Boy, got it right here in front of me. Boy, isn't that something else? You think you know everything and you don't. All right, we got Frederica Thomas will be on at 12 noon today. She has something going on this weekend, and she's going to let us know about that. So stay tuned at 12 noon today right here on WSAN Radio. As we say all the time, peace and chicken grease. We catch everybody at noon here on WSAN.